Thank you for the introduction. My name is Michael Ortiz, and I'm a pediatric oncologist at Sloan Kettering. I have a particular focus on children with kidney tumors and high-risk cancers that are hard to treat in children and young adults. And with Paul and Cindy's permission, I'm just going to initially talk about their daughter Alessia's story, and then talk about some of the other patients that I take care of and really that are some of the focus of tonight. So Alessia was a healthy 3-year-old girl who went in for a regular annual check with her pediatrician, who, after your experience, is now my pediatrician. But she noticed on her exam that Alessia had a mass. So there was something that she felt. And certainly that must have been, your worst nightmare come true. But fortunately, she reached out very quickly. You guys came. I saw you guys, I think, the next day. And we were able to get our surgeons to see her take this tumor out. After several months of chemotherapy, she finished treatment, and I'm happy to say that now, more than 2 years later, she does not have evidence of disease. Some of the kids that I take care of don't have as great of an outcome as Alessia does. And I think one of the challenges taking care of children with, thankfully, rare tumors is that there's not a lot of enthusiasm or interest in this. And that's why events like this that are focused on not just raising funds for research, but also awareness are so important. The tumor that Alessia had and that I see a lot of is called Wilms tumor. It's the most common cancer that children get in their kidneys, probably the 6th most overall common cancer. There's about 500 kids a year, and they usually present like Alessia, around 3 years of age, with a mass in their belly. And unless you know someone personally who's been through that, you've never heard of Wilms tumor. But this is a reality of something that I deal with every day. And unfortunately, not all the patients have the same good outcome that she did. And so that's a big part of the focus of my research, is trying to figure out new and better ways to treat these kids. Many of the patients who have Wilms tumor and are cured do have long-term side effects from the surgery, the radiation, the chemotherapy. And so we need new therapies that are better than the ones we have right now. And so that's been the focus of my research, is trying to find newer treatments that work better and are less toxic. And one of the things that we do at Sloan Kettering is for patients, including Alessia, who have surgery with us, we'll take their tumors, we'll grow them in mice, and we'll study them and try to find new treatments for kids using their own tumors to try to figure out better treatments, maybe not for them, but other kids that have tumors like them. And so doing that, we discovered that a drug that had been used for adults with certain kind of blood cancer looked very promising. But I'm happy to say that in the last few months, we just opened a trial of this drug in kids with relapsed Wilms tumors. And so the funds that are raised from this event and others are going to be used to try to help those kids that have relapsed Wilms tumors that don't have anything else available to them. And we're hopeful that this will show activity, and hopefully eventually we can move it into the front line and get rid of chemotherapy and still offer these kids these great outcomes. So I appreciate everyone who's here and for the support. And so certainly want to thank the Fagan family for hosting this event for a second year in a row, and for all of your time and support.
Thank you so much for the kind invitation. It is truly an honor to be here, and I just want to say I have tremendous, enormous respect for all of you as philanthropists. Some of you, directly or indirectly, have been affected by cancer, maybe with pediatric cancer. And what is remarkable is that instead of escaping and trying to forget about it and completely ignore the fact, you are here confronting the horrible trauma, the incomprehensible trauma that nobody else, unless you go through, you realize. So I'm very, very grateful and very pleased and honored to be amongst you today. Now, I'll give a little bit of a personal note. Whenever we gather to social events, we as pediatric oncologists, and Michael will attest to that, as soon as we are asked what we do for a living and we answer, there is a very awkward pause. There is an element of fear that it is so obvious. It makes us feel as personification of the threat of something that you don't want to even discuss. You think about cancer, you associate it with death, and to add to these children, you can imagine, you can understand why you have this immediate reaction. We are here today, and I hope with all the work that is going through the PCF, to at least alleviate this fear and this stress. The other question they ask me is, how on earth do you do this? And also, as a personal note, after long days at work, I will come home to my beautiful wife, who is also taking care of children and adults with cancer, dealing with the dental complications. But importantly, what I have learned through this job is to change the perception of life. So it's a matter of gratitude. When I see my girls smiling at me, I'm very grateful. When I see them dry their rich, healthy Persian Greek hair, I appreciate it, because this was not what I saw in the morning. When they ask me that, can I have more pizza because I have the appetite, I do appreciate it, because that was not what I saw in the morning. When they tell me that I want to go and play basketball and they have the energy, I'm very grateful. Also, in terms of how we cope and why we do this, there is the impact, and this is where the PCF also comes into play. About 4 or 5 years ago, when we moved back with Lela from the UK, my esteemed colleague, a very good friend, Michael Winner, who used to work at Columbia, introduced me to Nancy and the team from the PCF at Westchester, and we had our first meeting. And I can tell you, it was transformative. I'll explain why. These past 4 years, I take care of children with brain tumors. We, with the PCF support, and I think this is important to understand where all this effort goes. Not only for me, of course, but all the amazing work that my colleagues are doing. But I just give the example. We managed, one of the problems we have with the brain tumors is that although the drugs sometimes work in the laboratory, when we give it to patients, they don't reach the target, they don't reach the brain tumor. So instead of keep doing research with drugs after drug after drug, of failure of a failure of a failure, what we did at Columbia is we got teams together that leverage on new technologies. One of them is the use of subcutaneous pump under the skin with catheters directly into the brain that allows chronic infusion, repeated infusions wirelessly into the brain, so that the drug gets in there, the patient doesn't suffer the systemic toxicities, the side effects of the body, and at least the drug covers the brain tumor. The second one was the focused ultrasound, which, although is a technology that is rapidly evolving, at Columbia we're in a unique place through the biomedical engineering department to use a mobile device that allows the blood-brain barrier, the endothelial cells that protect the drugs from going to the brain, to separate. And indeed, we are about to publish these 2 studies, first time in the world at Columbia University, because of the PCF support. The Pediatric Cancer Foundation founded our research coordinator, who, for people who do research, can understand that you cannot do this without a person like this. So this is why This is the answer of why we're doing this, and this is the massive gratitude to the Pediatric Cancer Foundation. And all I can say, please keep driving the hope. Thank you.